kind of have a thing with height.
Okay, so got a tragus piercing. It's been slightly problematic, nothing too serious. Thing is that we have different access here to do maintenance of piercings than you would at home. Normally you'd be using an antibacterial soap, saltwater soak. I have a surgical soap. Most of you know it as green soap. So the way we do things around here is just a little bit different. Right now we're cleaning it up. The slight white or yellow secretion is actually just body fluid. It's not pus. Most people mistake that for an infection. A little discoloration around the piercing site, as you can see right here on the front of the tragus, is perfectly normal. You usually get bleeding, bruising, and swelling with any piercing. And this piercing's a few weeks old. We've just been having a slight issue with it. Apparently there was some makeup on it early on. Yeah. And on the inside, you may not be able to see it. You probably won't be able to, but there's a dark spot right in there. You probably won't get to see it. The camera's not good enough. But it's a localized piercing pimple. Sometimes you get them, sometimes you don't. There's not a lot that you can do to prevent it other than just basic cleanliness, and sometimes it just happens. The best thing you can do is sometimes they hurt, sometimes they don't. Sometimes you can drain them. They might come back once or twice. They might just completely go away. If not, if it constantly comes back, it's a good idea to go see a doctor or a physician of some sort and have them see what's going on, because odds are you got some sort of microorganism that's there and doesn't want to go away. So this is the original piercing jewelry. I used a 316 OVM implant grade surgical steel. So it is doing rather well. The swelling is pretty much all gone, and some of the fluid that's discharging at the moment is her losing the mass out of the swelling area. And as we all know, the body swells by pushing fluid to a spot. Anyway, we're going to move to the other side. Next ear. On this side we actually have a 2-gauge hole in the flat of the ear. Pretty cool piercing. Takes a long time to heal, however. Or at least it does in this particular incident. We're just going to do a little cleaning here. You always want to make sure you clean all the stuff off with the jewelry. That's where you're going to have your bacteria just constantly building up. And that is just not a good thing. So I always clean both sides of the piercing as best as I can without causing too much discomfort, but just got to get in there and do it.
Taking videos of all these now?
Yes, sir.
Scary.
Yeah, it is, huh?
406 Entertainment supports.
Thanks, Mr. Stacks.
Nice name drop.
Yeah. Oh, you gotta throw the name in the thing.
One thing to take into consideration too when you're dealing with this style of jewelry, it's a single flare, and it does have a rubber stop on the back, or an O-ring as most of you call them. It's important to make sure that that is cleaned off thoroughly as well. Maybe not early on during the life of the piercing, but later on it's always important to remove that and make sure that you clean around that, as that too will become a bacteria trap. So pretty simple. Take care of your piercings. Use a little bit of common sense. It'll take you places. Alright.